have, like when I go up, I have pain on the top right there. And then, yeah. And then when I go back in here.
So it looks like maybe just lower than her supraspinatus and then also on her bicep tendon, right? So let's do, let's find a, so go ahead and raise it up again. So let's get a snapshot in our mind about how far she is.
Yeah.
So we can even measure that. So why don't we measure that and we'll see what she got. So right now she is at 145, right? So before pain stops her, and then we need to know the intensity, right? So on a scale of 0 to 10.
It's like a 7, 8.
Okay. Okay, so go ahead. Let's find a point that connects to that. So you can, I would start in her shin. So let's find a lateral shin point that connects. And then raise it up again, let me see exactly where you, then point to me with your fingertip.
There.
Right there.
You want to mark it?
Yeah, we can mark it. That's a little lower than the map goes. Most people don't have pain there. Does it hurt to touch there?
Yeah.
Okay, so it's not referred. So let's find out, you might just have to move a little bit lower than the supraspinatus I mapped. So let's find a lateral shin. Yeah, that's the one I picked. Okay, so go ahead.
Do my arms make any difference which way my hands are?
No, not when we're treating. If we're treating your arm and we're using your leg, you could put your arms behind your head, it wouldn't matter.
Okay.
But this matters.
Yeah.
So this is pretty much on the LLI.
Yeah, we're at the landmark right there, right?
Yeah.
Okay. Now, I forgot what
So you take your fingers like this, right? Come right up against, we feel for the rise right there. And then these two fingers underneath this finger, okay? And then take this one, and then that one is LLA. So right here, we connect to the supraspinatus, okay? But if she turns her toe in like this, then right there, he's now connecting to her posterior shoulder. And if she turns it out like this, then he's connecting to her anterior shoulder. So these points don't match, and then nothing will happen. So the direction of force is straight through.
Ooh.
So now we can get the instant feedback, right? So go ahead and raise your arm up.
Come on.
So now she has full range of motion. But on a scale of 0 to 10, we need to know what we did. On a scale of 0 to 10, how would you rate your pain?
Right around here is like a 2.
Okay, so the next thing out of my mouth is what? When somebody says they have pain, what do I say?
Where is it?
Point to
your
it.
fingertip,
Point
okay?
where is it?
Go ahead.
Where's the thing on?
Is it higher?
Yeah, it's a little more posterior. Yeah.
So she's in her, she's actually in like the teres minor area. So let's find a point that connects in here. You can put that. What did I say her range of motion was in the beginning?
145.
145. And like I said, I'd like to just stay on the lateral shin so I don't have to position another body part, you know?
Page 20.
Good. He's at page 20.
Oh, got it. I think that's the main door. The main door of the house.
So, yeah, so you're on the bottom row there, right? So did you do your technique there to find it? I didn't see you do it, but.
Oh, not again, no.
Yeah, let's do it again. Make sure we're on it. Okay? There. And then there. And then we went down one, right? We went inferior one, it looked like. No, see, wait, hold on. I wouldn't choose this one right here because she's on her posterior shoulder, she pointed to. And this is more the supraspinatus on page 20. So let's scoot back to 20. Let's use the lateral shin. Let's find a point in the lateral. There we go. So let's use page 23. Okay? Let's do that one right there.
Okay.
So let me see, went up a little high. Right there, good. There. And then down, and then there. And then I just moved down one, right?
Down one.
Yep.
Okay.
So remember, so if she turns her foot in and out, this whole thing, nothing happens. But if this is right, then the maps are right, which they are, then this will release that.
But that hurts.
So go ahead and raise your arm up.
Nothing.
No pain?
No.
So she's at 170 something. So she just gained, yeah, she's at 170. So she just gained, what, 25 degrees? 25 degrees of range of motion, and you have no pain, right?
Correct.
Okay, good. Good.
Wow.
Yeah.
Now I can swim.
So, normally if you have a real patient, then you just do 1 point for 1 minute, or do like we did there, and then you follow it up with 3 other points for 1 minute, so the treatment effects last longer. Okay?